Hey guys, Dr. Z here. I received a question from Amy B regarding a health issue she was having. The doctor ran my blood and told me that I may be anemic. Her suggestion to me was to eat more red meat, take iron pills, and then recheck my blood in 3 months. I don't know if I should listen to her advice because I feel there is something wrong with my health more so than just low iron. I'd like to send you a copy of my blood work. Would you please look at it and tell me what's going on, as I have no idea what I'm looking at? Can you help figure out what's wrong with me and put me in the right direction to getting my issues resolved? Amy sent in her blood work and it appears that she has a significant iron deficiency anemia. At her request, I want to show her and you how to read your blood work to determine if you have iron deficiency anemia. Stay tuned. Amy also sent in a list of her symptoms, which included her being tired and fatigued. She was getting dizzy and she complained of shortness of breath. Amy also complained of having brittle nails and unusual food cravings. The combination of her symptoms and her lab work is definitive of iron deficiency. Let me show you what that looks like.
So let's talk about iron. Iron is an essential trace element needed for the production of healthy red blood cells. Iron deficiency is the most common nutritional deficiency in the United States. Iron is a component of heme, which is a part of hemoglobin, which is the protein in red blood cells that bind to oxygen that red blood cells transport throughout the body. Hemoglobin also gives red blood cells their red color. Now, what are some of the symptoms of iron deficiency anemia? Decreased energy and fatigue, dizziness, weakness, pale skin, shortness of breath, craving non-food substances. This is called pica. Crawling feelings in the legs, faster or irregular heartbeat, headaches, and brittle nails. If not enough iron is taken in through the diet or there is a physical issue causing a loss of iron, which I will talk about in a moment, your iron stores in the body begin to get used up. As iron stores are depleted, you make fewer red blood cells with decreased amounts of hemoglobin in them, resulting in anemia. So if there's decreased iron, there's decreased hemoglobin, not enough oxygen transported throughout the body, and this is the major reason why people get fatigued with this type of anemia. But here's what it looks like. To the left, arrows point to a small red blood cell with just a tiny rim of pink hemoglobin. To the right, arrows point to a normal red blood cell with a healthy amount of hemoglobin. It is normal shape and color. Iron deficiency is described as a microcytic or small, hypochromic or pale anemia. Again, looking at that small red blood cell to the left compared to the right, it's because of a lack of hemoglobin and the smaller shaped cell with the smaller rim of hemoglobin, again as a consequence of low iron. The symptoms of iron deficiency are related to the overall decrease in the number of red blood cells and low levels of hemoglobin, as I stated before. Some of the causes of iron deficiency include dietary deficiencies. Heme iron is the most bioavailable form of iron and found only in meat. Non-heme iron found in plant-based food is not as easily absorbed. And as you see in my Z note there, vegans and vegetarians need to be mindful of their iron intake as they don't get heme iron from animal-based foods. According to the Journal of the American Dietetic Association, make sure you eat plenty of foods high in vitamin C, as vitamin C helps absorb the non-heme iron found in plant-based foods. So if you're not eating meat, make sure you're taking something in with vitamin C, as vitamin C helps absorb the non-heme iron. Citric acid from citrus fruits enhance the absorption of non-heme iron as well. Citric acid is found in oranges, lemon, lime, strawberries, raspberries, and cranberries, which are all delicious on salads that contain plants that contain iron, including spinach. If you have an iron deficiency, stay away from grains, lentils, legumes, or beans, and nuts, as these food groups inhibit the absorption of non-heme iron. Another reason for iron deficiency is malabsorption. There are certain conditions that can affect the absorption of iron in the gastrointestinal tract. These include gastric bypass, celiac disease, surgery, Crohn's disease, and prescription drugs that reduce stomach acid. These are the proton pump inhibitors, or the PPIs. Examples of PPIs are Prevacid, Nexium, Protonix, Prilosec, and Dexilant. PPIs are used to treat reflux. Chronic bleeding or blood loss is another reason for iron deficiency. If bleeding is excessive over time, iron stores are depleted, leading to decreased red blood cell production and hemoglobin. In women, iron deficiency can occur with heavy menstrual bleeding and bleeding fibroids. In men, iron deficiency, although rare, can occur from colorectal cancer or some other disease. Stomach ulcers can cause a slow chronic bleed and loss of blood with subsequent loss of iron. That can occur from, or the ulcers can occur from drug use and H. pylori, which is a nasty bacteria that can harbor itself in the stomach, produce toxins, and then as a consequence, the body produces high stomach acid to try to deal with the bacteria, and ulcers are formed. To diagnose an iron deficiency, a complete blood count is ordered. There are several biomarkers that determine the health of red blood cells and iron deficiency. In the complete blood count, that includes hemoglobin, MCV, MCH, MCHC. Hemoglobin is a protein that transports oxygen. That is low. Mean corpuscular volume is also decreased. This is the average size of the red blood cell. The mean corpuscular hemoglobin is the average amount of hemoglobin in the red blood cell. That's also decreased. And mean corpuscular hemoglobin concentration is decreased. Here are additional tests associated with iron. Serum iron is the level of iron in your blood. This is usually decreased with anemia. Ferritin is a protein used to store iron. It is usually low with iron deficiency anemia. Ferritin has been considered to be the most specific test to identify iron deficiency, although I think all of these tests that I'm discussing here or presenting here are important to get done when you're looking at specific types of anemia. Total iron binding capacity, or TIBC, is a blood test to see if you have too much or too little iron in the blood. Iron moves through the blood attached to a protein called transferrin. The liver produces more transferrin, presumably attempting to maximize use of the little iron that is available, and this is typically high. Here is Amy's lab work showing the complete blood count and the biomarkers associated with the anemia. As you can see, there is low MCV, low MCH, low MCHC, and last, the red blood cell distribution width is elevated, which is another finding seen in iron deficiency. Here are the additional biomarkers. Iron binding capacity is elevated and ferritin is low. Here's another example from a different lab and a different patient. Hemoglobin, hematocrit, MCV, MCH are all low and the red blood cell distribution width is elevated. These patterns are typical of iron deficiency anemia. And as a summary, the lab work would show decreased hemoglobin, decreased MCV, decreased MCH, decreased ferritin, decreased iron, and increased TIBC. The red blood cell width is another biomarker as it is elevated with this type of anemia, so make sure you get that tested as well. To treat iron deficiency, you need to find the cause of the deficiency. Treatment of iron deficiency anemia typically involves changing your diet to include foods high in absorbable iron or heme iron. If you choose not to eat meat, then make sure you are taking in vitamin C or foods with citric acid so you can absorb the non-heme iron. Iron supplementation when needed. Be careful if you're prescribed iron supplements, as iron supplementation can cause significant constipation. However, if there's a suspicion of abnormal blood loss causing the iron deficiency, further testing is needed to determine the reason for the bleeding. Consider stool testing for H. pylori in blood that may be found in the stool. I use Genova Diagnostics for stool testing, and the test is GI Effects. It's an excellent diagnostic tool to look for H. pylori or blood in the stool. And last, those with iron deficiency may require a blood transfusion or intravenous IV therapy. When the underlying cause of anemia is found and treated, then the anemia usually resolves.
Hey guys, I hope that helped. Remember, if you suffer from fatigue, dizziness, shortness of breath, or you have changes in your heartbeat or even brittle nails, or any other symptom I mentioned in this video, get checked for iron deficiency. If you need help with your lab work, contact me here or find a specialist in functional medicine to not only decipher your blood work, but to figure out why you have iron deficiency and what you can do to get it resolved. I hope that helps. We'll see you next time.